Back and now want to get to a follow-up from yesterday. Today we are talking more about pancreatic cancer, which is one of the deadliest forms of cancer. It's often called a silent killer because it shows few symptoms until it's often too late. With a 5-year survival rate in the single digits, early detection can mean the difference between life and death. But until now, there's been no reliable screening method. That's where Project Purple and a groundbreaking $750,000 grant comes into play. Joining us this morning is Dr. Brett Shipper, co-physician-in-chief at Hartford HealthCare's Digestive Health Institute and one of the leading voices behind this groundbreaking initiative. Doctor, thanks for being with us this morning. We'll talk more about that initiative in a second. But for starters, why is pancreatic cancer so hard to detect?
Thank you for having me. Unfortunately, where the pancreas is located in the body, it's deep in the body, and there aren't a lot of critical structures around most of the gland. The pancreas has two main parts, the head and the body, and if the tumor is out in the body of the gland, there's really nothing around it. So a tumor can grow to quite a large size before patients develop any symptoms. In the head of the gland, there's a few more structures like the bile duct, so sometimes if the tumor grows near the bile duct, it can compress the bile duct and you can develop jaundice or yellowing of the eyes or skin and sometimes get a little bit of an early warning indicator. But unfortunately, because of where it is, the tumors can grow quite large and quite often, as you said, by the time it's identified, it's already pretty advanced.
So at this stage of the game, the screening process is not really that effective, correct?
Correct. There really hasn't been any screening up until this point. We've now developed this partnership with Project Purple, which now allows the people here in Connecticut to have screening.
Okay, Project Purple, that's the national nonprofit, and it's a bold effort to kind of change the way things are done. Can you tell us a little bit more about Project Purple and the vision behind this partnership?
Absolutely. Project Purple is an amazing non-for-profit organization based right here in Connecticut, and their mission is simple: to live in a world without pancreatic cancer. And in order to do that, they raise money using different areas such as running and marathons and other charity events to raise money to give significant amounts of money for research in pancreatic cancer, as well as giving back to the patients who have pancreatic cancer and subsidizing them when they're struggling to pay bills or need other needs that they can't achieve because they're battling the disease.
Doctor, mentioned off the top that your team just received a $750,000 grant to develop some early screening methods. How is that going to date?
It's going fantastic. The program has been up and running about 6 months, and we're already close to 200 people enrolled. The partnership is really critical because it's the funding from organizations like Project Purple that make these screening programs possible. And in collaboration with Hartford HealthCare, using the footprint of Hartford HealthCare, which is really all across the state, we now have access for patients, no matter where they live in Connecticut, to enter the program and be screened if they meet the criteria for screening.
Dr. Shipper, thanks for being with us and best of luck as you continue with your journey.
Thank you very much.